to our Unclenched podcast. Today, we're going to talk to a psychotherapist who also happens to be my sister. We talk about how your psyche can affect your TMJ pain and dysfunction. At the end of the podcast, we will answer a couple of questions from you, the listeners. Before we get started, I need to get caught up with Alex. What's up? What's been happening? And I want to hear about, if you want to share about a patient that you've recently treated.
Yeah. So what's up? And not a whole lot. We're kind of coming down from a very busy season, moving daughters, one to Denver, the other to Brooklyn, but everything's great. But I'm just so excited to meet your sister, and I'm excited to have her on the podcast because I have a patient that I'm like, oh, I can ask Priya's sister about this. But she came into the office maybe just about 3 weeks ago, and she had Botox poisoning. Did you? I never met in all the years of practice. I've never met anybody that had a reaction to Botox. So after a hour after getting her Botox, this just happened in January, she got like a little card for Christmas, like, to go to a spa place and get whatever she wanted. So she got a little bit of Botox, and an hour later, she ended up in the ER. She couldn't breathe. She was having different things happening with her body, and they didn't believe her that it was Botox. She was in and out of the hospital the month of January. I think she stayed in the hospital for about 14 days. And she's been seeing all sorts of doctors. But this woman is so and now everything affects her. Any kind of medication they start, and they waited too long to give her, I guess there's an antidote for Botox, and they waited too long to give it to her. So now she just has to wait until hopefully the Botox wears off. But in the meantime, they've tried other medications on her, and just nothing is helping her. And she's in such a bad way. And she's so fragile and so emotional. And I told her if I take her on as a patient, I have to drive the bus. But then I put a fixed orthotic in her. She just felt like she wanted to rip it out. So what did I do? I ripped it out. Well, not rip it. I didn't really rip it out, but I took it out. And then I have a removable appliance, so then she can feel like she has more control over it. But she's so frantic. She's my age, and there's just no really reasoning with her. So I don't know how to get that stress or that anxiety or that. I don't know how to reach her. I don't know how to just I just want to go like this. Okay, it's going to be okay. Just let me work and shake her. But she's not my kid. I can't do that.
You can do it. Well, you know what? That leads us into introducing our guest today. So
Good.
I feel like that's like the perfect intro to psychotherapist Neha Kumar. Welcome to Unclenched podcast, Neha.
Thank you. Thank you guys so much for having me. I'm really excited to be here.
Oh, Neha, I've heard so many great things about you. Why don't you tell us a little bit why don't you tell us a little bit about what you do?
Okay, absolutely. So I am a licensed psychotherapist. I have worked across a variety of, I would say, environments or facilities in order to help people with their mental health. I've worked with children. I've worked with adults. I've worked with populations from lower socioeconomic demographics, higher ones in rehab in terms of primary mental health and substance abuse. And so I, was very excited to come onto this podcast and talk about the connection between stress and pain, because there definitely is one. So thank you guys for having me.
Oh, well, thank you for taking the time. I know you're a young, busy mother too, upon everything else.
Thank you for taking the time. So tell us a little bit more about that connection between stress and pain. Like, how are those two linked?
Okay. So there's a definite connection, like I said. So stress can unfortunately exacerbate pain. and pain can also exacerbate stress. So there's this sort of vicious cycle that can happen with both of them. And it's really, really unfortunate. So if you're stressed, what that can do to you physiologically, it can lead to muscle inflammation, and it can actually make your pain worse. In some cases, there's psychosomatic pain where you're so stressed that it does actually manifest as pain. So, whereas, in other cases, there's actual physical pain that can cause stress. And then what ends up happening there is that unfortunately the stress makes the pain worse. So like I said, it's this crazy cycle. Stress can also cause a lot of, in addition to the inflammation, a lot of tension. So if you are somebody that's prone to headaches or back pain or neck pain, unfortunately, the stress can exacerbate that. Also, stress has the uncanny ability to increase the sensitivity of your nervous system. So that one is unfortunate. We all have our fight or flight mode, the sympathetic nervous system. And unfortunately, stress can make your nerves more sensitive to pain signals. So like I said, there's this feedback loop. The more pain you feel, the more stressed you get, and vice versa.
Mm-hmm.
Yeah. So can you talk a little bit about the pain cycle and the neurology of it?
Absolutely. So the pain cycle is a self-reinforcing loop. It's basically where you start out with pain, an actual physiological pain that your body feels. And unfortunately, like I said earlier, it causes stress, it causes anxiety. And then the stress and the anxiety cause the muscle tension, poor sleep, negative emotions. And unfortunately, all of those factors worsen the perception of pain. So the cycle continues. So it can do two things. You can have pain that actually is severe pain, and then the pains, I guess, physiological effect on your body can worsen the perception of the pain. So you have two different things going on, but both of
Oh,
them
that's interesting.
are
Yeah.
causing pain. Absolutely.
So do a lot of your patients have chronic pain? Is that what your practice consists of, or?
So it's not, I don't purely have a chronic pain practice, but a lot of people tend to have chronic pain, which makes sense because most of the clients that I have seen tend to have an increased amount of depression, anxiety, a lot of internal and external stressors. And what I mean by that, an internal stressor might be, dynamics within their home that have caused feelings within them, conflict, how they view themselves, how they view others, stress in relationships. And then as far as external stressors, maybe the demands of a job or the demands of being a parent or the demands that everyone has to pay their bills. So unfortunately, when we all have these things. So most of the people I see have all of these stressors, and whatever pain that they may have, even if it's not due to having been in an accident or having some sort of biological issue, their pain is exacerbated. So I would say that a good probably 60% of the people that I see have had some sort of chronic pain, unfortunately.
Wow.
Yeah.
Well, and how does stress impact sleep? Because deep sleep is so restorative, right? And I have fought so hard for my children to get deep sleep. I wear the Aura ring. I make sure I get enough deep sleep. My husband, so how does stress, I guess, impact sleep?
Yes, that's a great question. This also becomes a vicious cycle. So basically, when you're stressed, what that tends to do is it can, unfortunately, if you can't mitigate that stress, if it becomes a long-term thing, that can lead to anxiety, it can lead to depression. And both of those diagnoses, whether it's major depressive disorder, generalized anxiety disorder, or any variation of either of those two, how that leads to poor sleep is it can make you very, very, very anxious. And anxiety, that's self-explanatory. You're anxious if you have anxiety, and what that does is it can increase your heart rate when you try to sleep. It can make you ruminate on the stressors in your life when you try to sleep. And then even if you say you are depressed and you are having difficulty sleeping, even though your primary diagnosis may be the depression, because you're starting to experience poor sleep, you start getting really anxious about your sleep. So it's really, really unfortunate. But basically, any sort of stress that leads to depression, that leads to anxiety, can affect your sleep. It can worsen it. And then worsened sleep, unfortunately, leads to lower resilience, emotionally and physically. So lower resilience for the stressors and being able to
Mhm.
combat that mentally, and then lower resilience for pain. So essentially, lack of sleep, it impairs your prefrontal cortex. It makes it really, really hard to think clearly, regulate your
Sure.
emotions in an effective way. And so little things can feel really, really overwhelming, which
Mhm.
adds to your stress.
Right. So, what are recommendations for people who are dealing with chronic pain in terms of their mental health? And what is like the timeline that you say, okay, this pain is chronic? Like, is it so many months? Is it so many years? Whenever you say chronic pain.
Absolutely. So typically, how we look at chronic pain is it's something that has lasted over a longer period of time. I would say at least, and that's not caused by something acute that happened. Like
Okay.
you fell and
Broke your leg
you
or something.
broke your leg, and
Yeah.
then
Yeah.
you got the
There's
appropriate
a
medical
clear
care
cause.
for it. Yeah,
Sure.
there's a clear cause, and you got a cast, and you did everything you needed to do. In an ideal world, that person that fell and broke their leg would be healed by, I don't know, whatever, doctors say, whether it's 6 to 9 months. I'm guessing, not a doctor, but if there's any residual pain from that break, despite receiving the appropriate medical care, and it continues to bother you over time, irrespective of using, pain medication
Mhm.
or doing PT or whatever it is that's recommended, at that point, something like that would become chronic pain because it
Okay.
continues to bother you. And any recommendation I would make is if you know that you have had any sort of accident in the past, because sometimes this pain can show up much later,
Mhm.
which is sort of odd. You think you're okay. This happens a lot of times, we see with car accidents, where you're
Yes.
like, oh, I got into a car
Right.
accident,
Right.
don't really feel anything, went to the hospital, no internal bleeding. I'm lucky, nothing
Right.
happened. And then months later, you can wake up with this
Or
crazy neck
years
pain.
later.
Yeah, years, months or
Yeah.
years later, who knows? And so I would say, really taking the time to log those things. And what I mean by log it, even mentally, is if you know that had any sort of accident, if you don't feel pain immediately in the immediate days or weeks or months, sometimes we sort of forget about the incident because it didn't really have any lasting impact. But
Sure.
I would
Sure.
I would definitely recommend that you write those things down, you keep an eye on it. And so then if pain does start later, you can, try to make that connection so that you can offer that to any provider that might be looking at you. Because if you say it's out of nowhere and you're not able to remember that incident, then that can do you and it can do your medical team a disservice. So I would say keep a log of things that might cause pain later. I
Mhm.
would say really, really making sure that you're working with a great primary care doctor who is able to refer you to the right specialists, who cares enough to sort of keep an eye on things. Say they saw you, months ago, and
Mhm.
you mentioned an accident and, haven't felt anything since, then, somebody that's going to ask you 6 months from now, how are you feeling? How are you feeling based off of that? Are you still not having any pain, or are you also, as a mental health specialist, a primary care doctor that's going to prescribe pain medication in a safe way,
Yeah.
because that can go down a really dark path as well. And then and we know this, right? And in terms of mental health and physical health and pain, anything you can do to really take care of yourself proactively and preemptively in terms of getting sleep, getting adequate sleep, getting adequate nutrition, light to moderate exercise, whatever your body can allow. The more you take care of yourself now, the better off you're going to be if pain does come up.
Absolutely.
Mhm.
Hmm. It's interesting what you're saying, like how injuries from a long time ago can manifest at any time. So I I went and I got a really great lymphatic massage, like multiple ones,
Oh, yeah.
recently.
You need a trampoline to jump up and down on. That'll
Yeah,
get your
yeah, even
lymphatic
that will
system
loosen stuff
going.
up. But what's interesting is she was working on my hip and she said, "This is an old injury." She said, "When did you injure your hip?" And I was like, "I wasn't even active. All I did was like read books and watch TV. I don't know what you're talking about." She said, "You had I didn't do anything."
Laying
Went to
on
the
that
park.
one side injured your hip,
Yeah,
Priya.
I was like, "What?" Like maybe the way I'm sitting. And then I was like, "Oh, that accident." So, Alex, you don't know this. I was crossing the street in India as like an 8 or 9-year-old and I got hit by a car.
Oh my
Yeah,
gosh.
yeah, yeah, and I went flying, and, like, the only physical thing that they could find wrong, like, they, like, checked my brain, and apparently it's okay. Neha, you might argue that it's not, but they like, checked everything, right? And, the only thing that manifested was I had 2, uh, teeth in the front that were, like, really badly chipped. So I've always had composites
Wow.
there. I didn't even need root canals. Can you believe this? Didn't even come out, but anyway. So
Wow.
Um, but the lady, I told her, I was like, "Oh, I had this, like, really bad accident." And she's like, "How did you land?" And I was like, "I don't know." I was, like, 8. So I called my mom, and she was like, "I don't know." She was like, "I was so, like, in" she was
Frantic.
just in yeah, she was frantic. She's like,
Yeah.
"I don't remember." She's like, "That was so long ago. I don't remember how you landed." But the lady was like, "You landed on your hip." She's like, "You landed on your left hip because this hip is messed
Wow.
up." So she just, like, went in there, and there's, like, a lateral pterygoid muscle of the hip,
Oh
and
my
Alex,
goodness.
she went after that, and I was, like, screaming, and I'm not a screamer, like, I didn't even scream during childbirth or, I'm not a screamer. I'm
Yeah.
a loud person, but I
Yeah.
don't get louder
You're a
than my normal
talker.
loud. I'm a talker. I'm loud, but I don't get normal than my normal loud, right? And I was like, "What the hell?" And so I think that that injury, like, all was absorbed in that hip, right? And she treated that, and she also my the left side of my, neck has always had a big knot in it, like in the trapezius, and she was like, "Your hip," she's like, "That's a problem, and then your atlas is everything, C1, C2 is all crunched up." So she worked on me, and I have not had pain in my neck since, and, like,
Wow.
I feel so much looser, I feel great, so I do
Good.
think that these injuries can have such a, like muscle and fascia, everything has memory, right? So I think that it can, like, build up and, like,
Yeah.
compound and, like, show up later
Years
in our
later
lives.
show up.
No,
Yeah.
Yeah,
absolutely. Yeah, gosh,
yeah.
I remember that. That was terrifying, and
You
I must
remember?
have been
You were,
I
like,
do remember.
5.
I remember I didn't see the accident. I heard
Oh, I
mom
was like, "How'd I
scream.
land?"
I heard mom scream, and then we
Yeah.
all sort of, like, ran over to you. But yeah, though, that was terrifying.
You remember when we were flying back to the United States, there was a guy at the airport that was like, "I'll give you this tonic and it'll grow your teeth back."
I don't
And mom was like, "You're an idiot." Like, that's like, "No."
You're an idiot. Yes.
Even
Yeah.
even at
Love
that
that.
age, you could pull
Yeah.
out an idiot. You could picture who that
Oh
idiot
my
is.
gosh.
Oh
Oh
my
my gosh,
god.
it was so funny. Okay,
Only
sorry, we
only
got
India.
totally off t
No,
Yeah.
no, but I'm glad that you brought that up because pain does become a learned pattern.
Yeah.
And so, there's something called neuroplasticity, which is your brain's ability to essentially heal itself. And so when you have pain signals, if you have chronic pain and those pain signals are constantly firing, what happens is your brain strengthens those neural pathways. And so even when the original injury heals, your brain is sort of that pain circuit in your brain is still active. So your brain is sort of always ready to respond to pain. It's almost like it's primed for it. And so what happens
Yeah.
is your central nervous system, especially your spinal cord and your brain, they become overly sensitive, which is really it's not a good thing. And so normal sensations that we all feel in our day to day, like touch or warmth or even emotions, can be highly triggering to people
Mhm.
with
Mhm.
chronic pain. And so unfortunately with that, emotional pain gets tied into that. So the amygdala, the hippocampus, which are the emotion and memory centers of our brains, they unfortunately become part of the pain circuit. So the stress and the fear and even anticipation of pain that some people experience can actually cause pain. So it's very,
Wow.
Yeah.
very deeply rooted neurologically as well.
Wow.
Wow. So So do you send your patients out for chronic pain issues? And if you do, who do you send them to?
So that's a great question. It typically depends on what is causing the pain. It's a very case by case basis. So
Okay.
it depends on what is causing the pain. It depends on whether or not I'm currently working at a rehab facility, and if we have a wonderful medical nursing team, and so if they feel they're able to manage the pain, then they will go ahead and do that. But we are always, always advocating for the client if they need more. Typically, we want to make sure that the level of pain isn't such that it gets in the way of any sort of therapy, like mental
Right.
health therapy that we're
Mhm.
trying to do, because it sort of defeats the purpose. And ethically speaking, it's not right to take money from somebody that you can't actively help. And
Mhm.
so it's kind of a double-edged sword, because on the one hand, their mental health is likely suffering more because
Sure.
of the fact that they have this chronic pain, but the pain needs to be stabilized to a certain level for them to be able to engage. So we always want to make sure we're doing the right thing. If it's pain that can be helped with like gabapentin, that kind of thing, then that's wonderful. But if
Mhm,
it's
mhm.
something our medical or nursing team feels is either out of their scope or the pain is just too extreme, they will refer them out. And as far as who they refer them to, it sort of again depends on what's the cause of the pain, whether it's dental or it's some sort of
Mhm.
orthopedic thing. Just really depends.
Sure. Sure.
Right.
Mhm.
Right.
Can you tell us a little bit about, your husband, Nishant's headaches and neck pain? Because we went down a whole rabbit hole with that together, so
Yes, no, absolutely. So, my youngest daughter just turned 4, and when she was about a year and a half, my husband started to experience some pretty severe neck and upper back pain, and it was out of nowhere. I mean, he's in pretty good health. He works out pretty consistently, gets sleep, eats right, all of the things. And he could not for the life of him figure out what was going on in terms of like
Mm.
where this pain was coming from. And he did everything. He went to his primary care doctor, got a referral for an orthopedic specialist. They did all of the scans you could think of. He was referred to physical therapy. He was referred to massage therapy. He was referred to acupuncture. He was referred to a
yeah,
chiropractor, like
he went everywhere.
Sure.
absolutely everything, and nothing was working. And then there was one summer we were with you guys, and you were kind enough to make him orthotics, Priya.
Mhm.
Right? Is that what it's called? The
Yeah,
ortho,
that's it.
yeah,
You
the
got it.
orthotic. Yeah, I was
Totally.
like, wait a second. I'm thinking of like if the orthotics for feet, and I was like, oh, I think I just said the wrong thing. But you made those for him, and they did help him initially, but eventually the pain came back, and so finally. The chiropractor he was seeing said, maybe you should see one of our specialists called a cervical chiropractor.
Mhm.
And my husband Nish was like, how come nobody told me about this before? It was months and months and months of very severe pain. Dr. Alex, if I don't like Priya can attest to this, like there is nothing he loves more than being a dad and spending time with our
Aw.
kids. He's just like, that's all he's ever wanted is to be a dad. And this was getting in the way of him being able to
Aw,
spend
so
time with them.
sad.
And so he was,
He's very sweet.
yeah, he was just like devastated. He was really trying to find an answer to this. And so he went to the cervical chiropractor, and within the first session, he felt like he told me he came home. He's like, I feel like 90% better. He
Oh
only had
my
to see,
word.
yeah, it was amazing. It was absolutely amazing.
Wow.
So sometimes it's about knowing, which specialist to go to. Unfortunately, it can take a while to figure that out. But I mean, up until that point, though, neither of us knew that cervical chiropractors existed.
Mm.
I
Wow.
didn't know till 2018 when I met Dr. Parker, and
Yeah.
I was very, skeptical, and I didn't wanna, like, believe in
I
what they were
know because
doing.
you think your neck and you just don't want somebody in there to like do those harsh cracks and jolty,
Yeah.
cracks. It's got to
It's
be
scary.
low manipulation.
Yeah.
Yeah, yeah.
Yeah.
So what sources are out there for people who are searching for help for their mental health? and their mental well-being. Like this patient that I told you about to begin with, like, how do I reel her in and get her calm too? Because I know it's tearing her apart, and mentally I know things are happening.
Well, do you know, do you happen to know if she's seeing like a mental health provider?
Since this just happened in January and I haven't seen her yet so much, and just the franticness, and I don't think so, because right now she's on the medical rampage, the neurologist, the internist, the infectious disease doctors, because they were thinking it was something else infectious disease wise. So, I don't think, and that's where I just like want her to stop and take a breath. And it's like, you can't turn off their mind.
No, exactly. And that's what's really hard. I know that for mental health professionals, something that we try to utilize is, when a client comes in, we get whoever they want in their life, to sign on for a release of information. And it is pretty standard practice if we feel like a client is sort of spinning, that we ask, again, their permission to maybe talk to somebody in their life. Because here's the thing, they don't, if it's like a standard outpatient therapy, or for you guys too, I mean, how often do you really see them, to make a huge difference in their day to day? Obviously, if you're giving them treatment and you're relieving pain, that's different. But in terms of these kinds of issues where you may not see them that often, it can be helpful to get in touch with somebody they've allowed you to get in touch with and say, hey, or say like, hey, you want your spouse or your friend or whatever to come to your next appointment, because then you can sort of work with them to kind of calm the patient down. So I would say trying to sort of get in their corner and get with somebody that's they're close to, so that you can sort of work on it together if possible. But then also asking, are you talking to anybody about this? Because I recognize that obviously you want answers and treatment, the right medical treatment, but this is really affecting, how you emotionally or mentally, and seeing if they're maybe seeing anybody. So those are two things. So just sort of trying to build their insight into how much they're perseverating.
Okay.
Sure.
Okay. That's good.
Well, we have a few questions from our listeners that you might be able to help answer. Alex, did you want to ask the first question?
Yeah. So we know too much caffeine can make TMJ, TMD worse, and it dehydrates you and what have you. So how are caffeine, stress, and pain linked? Is there a link?
Oh, absolutely. And I have learned that, unfortunately, from
The
personal
hard way.
experience. Yeah, the hard way. So, I noticed, full disclosure, actually about 6 weeks ago, I had a hysterectomy for endometriosis, which was diagnosed much later in my life than I would have liked, but it is what it is. It's done now. And I also, received confirmation that I had adenomyosis as well, which they find out after the fact, which is it's like a sister diagnosis to endometriosis, but both of them can cause a lot of pain. And what I noticed in 26 years of having a menstrual cycle, that if I had caffeine the first couple days of my cycle, which all women know the first couple days are the heaviest and the most painful for the most part. I would say for 95% of us, that's the case. The caffeine would worsen it. It would really, really increase the pain, not only in terms of intensity, but also
Not interesting.
That is interesting.
Yeah. And so when I brought it up to my OB-GYN, she said, yeah, definitely decrease your caffeine intake, especially those few days, because it will make your cramping a lot worse. So that was not fun. And so I did some, at the time I was like, what is the link? And so I did some research into it. And basically, if you're really tired from poor sleep or chronic pain, most people will drink caffeine to sort of power through. It's kind of become, I like to call it mom fuel, because I didn't really start drinking caffeine until after my first daughter was born 9 years ago. and you just need it. It becomes a little bit of a crutch, unfortunately, but you're just so tired in those early days. But basically, if you're caffeine will boost your cortisol. So the more you drink, the more it boosts your cortisol. And unfortunately, that boost in cortisol makes your pain a lot more noticeable. It makes your stress levels higher. So
Wow.
you feel tense, you feel overwhelmed, you feel more pain, and unfortunately, it worsens your sleep. It increases your stress and all those things, and then it's just a cycle, right? Because if you're more tense, you're more overwhelmed, and your sleep worsens, then if you don't know it, you're drinking more caffeine to make up for the poor sleep.
Oh,
So
wow. There
yeah,
you go.
Isn't
yes,
that
but I don't.
interesting? Like,
Yeah, but I just want to say it isn't. It really depends on the dosage, and if it's a low to moderate amount,
yeah,
it can help improve your mood and focus. So coffee is not necessarily some big culprit. It's just a
Mhm.
lot of us tend to overdo it on the
Like a
amount of
pot.
caffeine that we're
Yeah.
having. So that we're having. So it's about the timing, the dosage, how sensitive your body is. So you can play around with it a little bit, but just know that if you're having issues sleeping or you have really painful periods or
Mhm.
other issues, that the
Mhm.
caffeine can worsen it. So just watch how much you're having.
Yeah.
yeah. I had a patient recently who told me she was drinking between 9 to 12 cups of coffee a day,
Ugh.
and weightlifting, and she's in so much pain, and like doing all these shoulder presses, which you're gonna trigger your neck muscles, which
Sure.
and she wanted this magical appliance that was gonna take away all her pain. I'm like, "That's not gonna happen." Like,
Yeah.
that's one part of it. Like, your bite is playing a role because it was, but there's all these other things that are contributing to your pain. There's no magical appliance that's gonna take away all the
Right.
dehydration in your muscles from all the caffeine. There's
Right.
no magical appliance that's gonna, like, follow you to the gym and make you stop, like, trying to build up your shoulders. Like, there's only so much I can do if you can't make any lifestyle changes, and she really didn't wanna hear it. Like, I said it a lot nicer than what I just did now, and she was just like, "I've worked so hard to lose all this weight, like, and the caffeine helps me stay awake, it helps me get to the gym, it helps me." I said, "I understand, and I'm just telling you, like, what I can do, given your lifestyle if you're not gonna change it."
Mhm.
And that's
Mhm.
the thing. I think a lot of times when people get in these routines where
Right.
it's working for them in the short term, they don't obviously recognize that these long term, there's going to be a lot of downsides to it. But ultimately, one, that much caffeine is just not good for you. But then two, where is she getting her water in? you
Right.
know,
Right.
like
Right.
which is
I
a
know, I'm like, "Do
must.
you drink water?" Like,
Right.
I don't know.
Right.
So another question, are anti-anxiety medications linked to more clenching or bruxing activity?
Yeah. So that's a good question. So there are a variety of different anti-anxiety medications or anti-anxiolytics, and so as well as antidepressants. And sometimes, the same medication is used for both. And so not all of them are. So not all anti-anxiety medications are linked to clenching or bruxing. Some are. It's
Mhm.
the SSRIs in particular.
Right.
And so and again, it's only in a small percentage of people. So not everybody that takes an SSRI will necessarily experience or engage in clenching or bruxing. So
Mhm.
basically, what that link is it's the serotonin level. So SSRIs increase those levels in the brain because it's the serotonin levels that help to regulate mood. But serotonin also affects dopamine. And so that is can be a negative thing in the sense that it's parts of the brain that control movement and muscle coordination, like the basal ganglia. And so the catch is that too much serotonin can sometimes inhibit dopamine. And we have to have the proper level of dopamine in order to ensure that we have smooth muscle movement. So if the dopamine is inhibited, what that can lead to is involuntary movements or tension, and
Mhm.
that's what can lead to the clenching, grinding, bruxing, all of that.
Same.
So you have to be careful with some of the medications that you take. And if you are noticing that you started this SSRI and you're starting to clench, or grind your teeth or that kind of thing, then it might be worth it to consider switching to a different medication that will help with anxiety, but that won't lead to all of those things.
Great, great. So, another question. How do you know if you're clenching or bruxing?
Oh, that is a you guys question. I mean,
Yeah.
I would imagine you can feel the
Yep.
clenching when you're doing
Yeah.
it, but I'm not sure.
I think that it's I think one, you can tell on x-rays because a lot of times this bone right here is even more well pronounced, or people's muscles are a lot bigger, but they're going to have soreness, they're going to have headaches, maybe tooth problems, maybe bruxing. Usually somebody else will hear you. But it's funny when I start patients in our orthotic treatment or whichever treatment we're doing, they'll start to pick up. I notice whenever I'm clenching, now I notice to stop. Like before they have
Yeah.
never even picked up on it
Like
or
there's an
knew.
awareness.
And I'm like, now you're aware. So they can control it a little bit better. But so that's basically it. Whoever that question came from, I think. Priya, what do you think?
Yeah, I think you can tell if you're clenching, like if you catch yourself during the day, but you have to really be like looking for it, right? So
Mm-hmm.
a lot of people do it without even realizing it. So like what I challenge people to do is like if you're stressed or you're stuck in traffic or you're working on something or watching a show that's suspenseful, like take a minute and see where your teeth are. If they're together, that's
Right,
clenching.
right,
Grinding is easier to catch because you're moving your whole jaw around. You're like much
right,
more aware of that movement, but clenching is hard. And waking up with your jaw clenched together or waking up with your
right,
teeth
right,
grinding or waking up with headaches, like those are the things I tell people to watch for, or like waking up with jaw pain or neck pain. Those are usually indicators that you're clenching or grinding, but it can be hard to tell because you're asleep,
right.
right?
You're
So
asleep, and the if you're grinding, you got to be sleeping with somebody, and they'll tell you, "Hey, you
they'll
were
tell you.
moving your jaw."
Well, it's
But
interesting
other than
too
that,
with grinding, like my best friend Matt grinds his teeth. And we all had this huge epic spring break, and, we all slept in the same room in, like, sleeping bags, and I could hear him grinding his teeth. I was like, "What is that noise?" Like, I'd never heard anything
yeah,
like that before, right? But then my son, my little guy, he also grinds his teeth, but I have slept next to him so much because I love sleeping next to my kids. I don't care what
uh-huh,
anyone says about co-sleeping, Imma do what I want. I sleep next
uh-huh.
to my kids all the time, and my son's teeth are ground down. He grinds his teeth, but I've never heard him do it.
Well, does he have airway issues?
Yeah, he did. So he
He
had,
did.
his tonsils and adenoids out in January, and so he's
Uh-huh.
much better now. So he doesn't have airway issues now, but he surely did, and but I never heard him grinding, but I saw the signs on his teeth. So is grinding always super loud? I don't know. Like, I'm a little perplexed.
Usually on kids, you hear, "You must have just been overworked and out like a light, and you couldn't hear him at
You know
all because."
what? When I'm next to him, I sleep my deepest sleep. I'm
Well, there you
so
go.
comfy-wumpy with him, and then my daughter
Yeah,
and I, like, feed off each other's energy. Like, we'll stay up all night because 'cause we're like, "Oh my
yeah,
god, we're together, we're having so much fun." And then
yeah,
my son and I will just pass out. So maybe I was just in deep, deep sleep, you know? We'll never know.
yeah,
But
yeah.
anyway, so thank you so much, Neha, for being here with us. I do wanna take a moment to let our Unclenched viewers know that my sisters and I are starting our own podcast, which will release its first episode in May of 2025. It's called You Should Call My Sister. So, Neha,
I
what do
love
you
that.
I know, isn't it cute? So, Neha, why don't you explain the title and like tell people what it's about? Because I don't think I've explained why we call it that to to Alex.
Oh, okay. Awesome. So our older sister, Komal, Dr. Komal Patel Sisodia, she is an endocrinologist. She's amazing at what she does. And she is also I guess you could say an expert in, any sort of reproductive perimenopause, anything that has to do with like hormones. So she talks a lot about menopause, perimenopause, that kind of thing on her own podcast, Reset Recharge, but she is a wealth of knowledge for in her field. Same with you, Priya. You're amazing at what you do. An amazing TMJ specialist and doctor. And then I've been in the mental health field for some time, and I've also been through
You're
some of
also
my own.
amazing.
No, I'm all right. I'm all right. But I've been through some of my own, mental health stuff, pretty severe postpartum depression, infertility. I was a caregiver for both of my in-laws who were terminally ill and passed away within
Wow.
2.5 months of each other. So a lot of grief and loss stuff, also some late adult stage like diagnoses that kind of came out of, not completely out of left field, but definitely, made me think about women's health and certain, some of the things that we've been gaslit on. And so my sisters and I, we have this funny thing where, if somebody tells me they're having jaw pain or they're having, they're experiencing hot flashes and they think they're too young to be, starting menopause, in both scenarios, you should call my sister.
There you
You should
go.
call my sister. And so, and I think, from what I understand, Priya and Komal do the same, when they're speaking with people as well about us and each other. And so we thought you should call my sister would be a really, really great title because it's cute and it's catchy, but also our main goal is to advocate for people and women, especially in terms of all types of health, whether that's their mental health, their physical health, their dental health, because there's actually so much overlap between chronic pain, mental health, hormones, all those things. And so we it's definitely, it's informational, it's educational. We have fun doing it. It's not super serious. It's somewhat lighthearted, but we want to help address any misconceptions that may be out there in our respective fields. And we also just, want to empower women and people to advocate for themselves.
And there's a segment, Dr. Alex, called Sistery Science Theater. Have you heard of Mystery Science Theater?
Mystery what?
Mystery Science Theater?
No.
Heard of that?
Yeah.
It's like this old show where it was like these three little like people in the corner of a theater. Like you could see their silhouettes.
Yeah.
I think one was a robot, one was a human, and what's the other one?
Two were robots and one was a human.
Two are robots.
But wait, time out. You guys are a lot younger than me, so that might not have been around for me.
No, so here's the thing. It was actually created, I think, in like the early to mid 90s. But what they do is they take
Alex is just laughing at us.
Really old, like B movies from like the 1950s, like sci-fi, black and white B movies that are just horrible.
They're horrible.
Alan, it's Alan's favorite show ever. Oh my gosh, thank you.
He said that?
So it's one of our favorite shows ever as well. So what these two robots and this man do is they watch this horrible movie from like the 1950s, like The Blob or whatever.
The Birds. Remember The Birds?
Yeah. Well, they won't touch Hitchcock. Hitchcock is like cinema gold, but like
really
bad movies that you've never heard of because they're just so bad. And they will just sit in the corner and they watch the whole movie, but they just make fun of it ruthlessly. Like
it's so funny. We used to rent these VHSs from Blockbuster. Neha and I would go and we'd be like, which Mystery Science Theater are we going to get? So we made Sistery Science Theater. So we break down like health myths about women.
Oh, that's good.
Yeah.
Well, I can't wait to see you on Call My Sister.
So basically, yes, what we're telling you right now is that we're massive dorks. And you'll be able to see that on our podcast.
Well, thanks again for joining us. And to all of our viewers, make sure you check out You Should Call My Sister. And hopefully we'll see you next time on Unclenched.
Yes, thank you guys so much for having me.